Good morning. I'm Ashley James with Good Morning Maryland on ABC2. Thanks for joining us. We are talking digestive health today with the Chief of Gastroenterology from GBMC, Dr. Niraj Jani. Hey, Dr. Jani.
Hi,
long time no
morning.
see.
Yes.
All right, so this is a great time for you to ask your questions to Dr. Jani, anything to do with digestive health. We have some questions that have already been submitted, but please feel free to write in your questions on Facebook. I'm going to have my phone here, so I'm going to be checking out the Facebook Live so we can keep up with people and interact.
Sure.
All right, so let's get started. So somebody wrote in pretty general question talking about a colonoscopy.
Okay.
Not the most glamorous topic to talk about, but the question says, my relative is terrified of having a colonoscopy. Are there other screening options out there that are available to them?
Sure. So colonoscopy still remains the gold standard for screening. But in those patients that are very afraid about colonoscopy, the two newest tests that have come out are actually stool tests. And one is called a FIT test, and the other test is called Cologuard. So these are simple stool tests that you can do in your home, where you submit a sample, you mail it in, and they have a very high sensitivity for detection of colon cancer, and maybe the gateway as a way of effectively screening many of our patients, and also maybe convincing patients, if that test is positive, that they do indeed need to get a colonoscopy. There's also something called virtual colonoscopy, which has been around for over a decade, which is a radiographic imaging test, a CAT scan, but you do need to do a bowel preparation prior to that. And then there's other screening tests which maybe are not as good, but there's definitely other means to obtain this information.
Okay. So there are some other options out there, though, that are great. Now, is that something that you can just get yourself, or do you have to talk to your doctor about which ones you'll be
Sure.
taking?
So I think it's well, you definitely have to speak to at least your primary care physician, and in many cases it's probably beneficial to meet with a gastroenterologist so he can review or she can review these different modalities and see what fits best for you.
Well, we're on the topic of getting a colonoscopy. We might as well just remind people, what is the age that you tend to tell people to start getting screened?
Sure. So the normal screening in healthy adults should be at age 50. If you've had a family member that's had a first-degree family member that's had colon cancer, it should be 10 years prior to when that family member was diagnosed. And so in African Americans, there is a recommendation that we should start screening at age 45.
Okay. And will health insurance cover that if you need to get screened prior to 50?
Yes, absolutely. Long as you meet the criteria I'd stated, it is fully paid by health insurance, as well as there's many community programs that not only pay for the colonoscopy, but also pay for the bowel preparations and even can help arrange transportation.
Okay. Another question that came in, what is causing my constipation?
So constipation is a very widespread problem and is really multifactorial. Common things that cause constipation could be related to medications that you may be taking. It may be related to what's called functional bowel problems, either motility problems where your colon is not contracting like we need to. It can be also due to what's called pelvic floor problems, where you have some trouble with emptying your stool. In severe cases, it could also be due to a mechanical obstruction, which is why if it's a new onset constipation, you want to be evaluated because we want to rule out anything like a mass or tumor in the colon. So there's really very many reasons. It could be due to dehydration as well. So it's very broad, but these are some of the common reasons why people may have constipation.
And going off of that, how about bloating? I'm sure that's pretty common.
Right, so bloating is a common problem and may be often tied into constipation. But bloating is really a syndrome or a symptom of either excessive gas. It can be related many times to diet. It can be associated with acid reflux. There's also something called small intestinal bacterial overgrowth. So again, these are very sort of broad terms, and the list of what causes this is many. could be one symptom that's part of a constellation of a problem.
So if you are constipated or bloating, I'm sure every now and then might be typical for people, but when is it to that point where you need to go see a doctor?
Sure. Great question. Right. So, you may find that, intermittently you may have occasional constipation, which is not unusual. But if these symptoms are lasting more than several months, I think it should be evaluated.
Okay. Are there any over-the-counter products that you recommend for people for just who have the occasional constipation or bloating?
Sure. I mean, so one with constipation, I think even before we start talking about medications is looking at your diet. So are you getting an ample amount of fiber in your diet? Fruits, vegetables, is it a well-balanced diet? Are you well hydrated? So before I even jump into any type of medications, those are the things I like to review with the patients. And second, there are actually a whole host of over-the-counter medications, everything from simple laxatives to tablets that you can take. So again, this has to be tailored, to the specific patient.
So I've heard you mention diet a few times. So going off of that, does eating a lot of spicy foods cause digestive problems, or is that just a myth?
So I think it's more of a myth. Obviously spicy foods may be associated with more acid reflux, more indigestion, heartburn, but it doesn't directly correlate with any specific, gastric or gastrointestinal symptoms.
All right, another question we have coming in is, I think I may have IBS. What do I need to do to find out for sure?
Okay. So, IBS, or irritable bowel syndrome, has very specific criteria. And actually those criteria are called the Rome-4 criteria, which are the latest criteria. The definition of irritable bowel syndrome is really abdominal pain with either diarrhea, constipation, or a combination of both. And you've had to have these symptoms for greater than 3 months. So, I think if you're concerned about this, the next step would be to, talk with your physician and have them do a full, evaluation and determine if this is what is truly there. Often irritable bowel is a diagnosis of not just based on symptoms, but a diagnosis of exclusion. So we want to rule out other types of diseases as well that may be causing your symptoms.
Okay, we have a question that just came in. I have Crohn's with severe bloating. Nothing is helping. Any suggestions? Again,
specifically, I think in your situation, one is we want to make sure that your Crohn's is under control and in remission. And often with patients with Crohn's or ulcerative colitis, the inflammatory bowel diseases, we do see an overlay of irritable bowel. So, I would sort of defer and say, yes, there are some suggestions, but again, it takes time, and, I would set up a meeting or an appointment to see a gastroenterologist and discuss that further.
Yeah, and keep the questions coming in. This is what Dr. Jani's here for. We appreciate it. It's a great time to get your questions answered. Okay, so I see a lot of commercials about probiotics, and we've had some questions come in.
Sure.
So first we'll start with, as adults, probiotics, what are they? Are
Right.
they good? Should we be taking
So
them?
I think this is a great question. I think probiotics over the last several years have gotten a lot of press. There's many different types of probiotics. I think the general consensus is that probiotics are good in certain scenarios. Particularly, they're very helpful in those that have had an infectious diarrhea that they're trying to recover from, or they've been immunocompromised, or they've had a recent dose of antibiotics and now they're suffering from diarrhea. There's really no harm in taking probiotics, but I think in general adults who don't really have any other symptoms, there's probably no indication to just routinely take probiotics. Now, I will say many patients with bloating, gas, irritable bowel type symptoms often feel that they're improved with probiotics, although there's no clinical evidence to support this. What's most important also is seeing what strain of bacteria and what particular probiotic you're taking. And again, this should be something that's discussed with your physician and picking the right probiotic for what you may be needing it for. So overall, I think it's it's helpful in those 2 or 3 particular scenarios. Now in children, probiotics have been shown to be very helpful, and again, infectious diarrhea or post-infectious diarrhea.
Okay. I thought this was an interesting question because I've been hearing a lot about this myself. The apple cider vinegar, pretty popular when it has become increasingly popular and claims to improve digestion, but I've also read that it has shown to delay the rate at which food leaves the stomach. So just in general, apple cider vinegar, good, bad for us?
Right. So I'm a big fan of apple cider vinegar. Again, I don't think there's clinical studies or you won't find an evidence-based trial, but it has been reported to be very helpful in digestion, but particularly in acid reflux. What it helps to do, even though it's acidic, is it helps increase your bicarbonate in your upper gut, and that may serve as a protective barrier or a buffer for acid. So yes, I'm a huge fan of it. I see nothing really wrong with it. And normally the way I tell patients to take it is either they can get the liquid, I have them take a tablespoon, put it in 8 ounces of water and drink it, or now you have apple cider vinegar capsules that you can take.
Okay, someone just wrote in that I have symptoms of Crohn's, but several doctors have said no. But I seem to have all the symptoms, lots of weight loss. What's your opinion?
So, again, I think that there's 2 ways of coming to the diagnosis of Crohn's. The gold standard is still with endoscopy and colonoscopy, but there are blood tests for Crohn's that can be looked at. There is also other adjunctive testing, such as imaging, to help make that diagnosis. So I think that if you're concerned about this, that a comprehensive evaluation should be performed.
Yeah, and it's interesting that we've had a couple questions about Crohn's come in on our Facebook Live. Is that pretty common, or do you see it a lot?
So we do see Crohn's quite commonly. It is one of the hallmarks of inflammatory bowel disease. Particularly in inflammatory bowel disease, we have what's called this bimodal distribution. So we do see a lot of patients that are in their early teens, 20s, and then there is another peak, often in the 50s and 60s. So yes, I think it is one of the common diseases that most gastroenterologists will treat.
Okay. Somebody wrote in saying that I have been taking over-the-counter Prevacid for a year. The box indicates not to take it for more than 14 days unless a doctor directs you. I have not informed my doctor that I've been taking this. Should I be concerned?
Sure. So again, a great question. Since this class of medications has received a lot of press over the past year, and the reason, just to clarify why the box says don't take it for more than 14 days, is that we don't want to be masking something that may be more serious than just some simple heartburn. And the recommendation is to seek medical evaluation further to make sure that we're not missing something. So in your case, I would recommend that you do see a physician and have them evaluate, is it just heartburn, is it gastroesophageal reflux disease, or is there something more serious that needs to be evaluated?
Okay, we've had another question just come in. With the recent increase in the incidence of bowel cancer in younger adults, when do you recommend patients get a colonoscopy if they have a family history? And I know that we spoke about that a little earlier, but as people tune in, we can say it again. And then also, what do you attribute the increase in young adults to? Sure.
So this is an article that came out over the past month that is showing that there is a higher incidence of both colon and rectal cancer in patients that are 25 to 40 years of age, and as well as in the 40 to 49 year of age group. And we really don't have a clear answer. We think that part of the reason there's this increase is probably related to diet and childhood obesity, as well as, I'm sure, many of the foods and processed foods that are in our diet. There may be also underlying genetic risks that we just have not identified in these patients. And so, as far as screening, again, if you've had a first-degree relative that's had colon cancer early in their life, then you should be screened 10 years prior to when that relative was diagnosed. And more importantly is that if you've had multiple family members, you should undergo genetic evaluation. because there are several syndromes that are associated with increased risk for colon cancer and colon polyps. So.
She followed up by asking if you do find a polyp during a routine test, how often should you follow up if you're younger?
Sure. So the guidelines are really based on what the pathology is of that polyp. Generally, for most standard polyps, we'll repeat the colonoscopy in 5 years. But depending on what the ultimate pathology, that is what really dictates when the screening interval is.
Okay. Another question that just came through on Facebook, do you really feel that most of these problems are food related in some way, either reactions from GMOs, chemicals, etc.?
Again, there's a difference between what I feel and what's reality. I mean, well, I do feel that, yes, but again, the only way to prove that is we need an evidence-based trial, or even a trial that would compare, let's say food in the western part of the hemisphere versus, let's say, the Far East or a different geographical location. So it would have to be a controlled study, really, to determine that. But we definitely know that obesity, there's a link to many cancers. And I think that is something that we need to address.
Another question coming in, when can I stop screenings, colonoscopy screenings?
Sure. So the current guidelines say we should stop screening at age 75. However, we've noticed that sort of as our population is aging and is healthier, we are extending in certain circumstances screening to age 80.
Okay, and you said that that's a question when I spoke to you this week.
Sure.
That you get a lot.
Yes, absolutely. So we have a lot of 80-year-olds or 80-plus-year-olds who are very healthy who don't understand why we should not screen them. And so this has been looked into. We know that as we age, the incidence of colon cancer rises. However, if you do a benefit-risk analysis of all patients that are in their 80s and 90s, it doesn't play out to do widespread screening.
Okay, another question we have for you. What causes a blocked intestine? Is it difficult to diagnose? What causes blocked intestine?
Okay, so if I understand you correctly, you may mean like an intestinal obstruction. And again, this is depending on where you're blocked or obstructed. There's a variety of reasons for this. The most worrisome, of course, is if there's a tumor or a malignancy or some type of benign growth. In certain circumstances, it could be if you've had prior surgeries, it could be from scar tissue. It can also be from another process called intussusception, where one part of the intestine sort of blocks another part. So again, there's many causes for this, but these are some of the common reasons why that can happen.
Okay. I feel like I'm irregular going to the bathroom. I either can't go or it seems to be an emergency. Is there anything over the counter I can take to keep me regular?
Again, we need to find out the underlying reason of why you're irregular. So are you irregular because there's either slow motility or you have too fast motility, or is it irritable bowel? So again, I hesitate to recommend any one medicine, but we really need to know why that is, and then based on that, there's proper treatment.
But that would probably in itself be enough to go see a doctor.
Oh, absolutely, sure.
Okay, another question coming in on Facebook Live. Some people are a little afraid of getting a colonoscopy, or a lot afraid, right? Okay. Can you talk us through what is required before specifically and what to expect during and after the procedure?
Absolutely, and I appreciate the question. So again, I think it's important to really clarify how simple this procedure is. The number one thing I hear from patients when they're done with the procedure is, oh, that wasn't that bad. So the hardest part, and every study and what patients will tell you, is the preparation the day before. So often we'll ask patients the day before to be on a liquid diet, and the evening or late afternoon they'll start a bowel preparation to help clean their bowel. Now I will tell you, bowel preps have gotten significantly better over the past 5 years. They're much easier to tolerate, they're better tasting, and they're very effective at doing what we need, which is really to clean the colon so we get a great look. And then we ask patients not to eat anything after the midnight prior to the procedure. They'll often come for their procedure. There is anesthesia involved. This is another common question is, am I awake or am I sleeping? And again, this is really a patient preference. I've had some patients who don't want sedation and are able to actually tolerate a colonoscopy without much difficulty. But for majority of patients, we are using anesthesia, so you are asleep and comfortable. The procedure is generally 20 minutes or less. And afterwards, you may rarely have a little bit of gas, but really no pain, no discomfort. The procedure results are then discussed with you in recovery. You're given something to eat, and you go home and go about your day. Now, because you've gotten sedation, you can't drive that day, or often I will tell patients you have to take a day off from work, but by the next day, you can resume all your normal activities. So it really is a fairly simple procedure. The risks of the procedure are very, very minimal. So the biggest risk of the procedure is something called perforation, which is an accidental tear or hole in the colon. If it is recognized immediately, it can often be repaired at the time of the colonoscopy. In certain circumstances, it may require surgical repair. Other risks such as bleeding, infection, the risk of sedation or anesthesia, again, are very, very minimal. So overall, it's a very safe procedure. It's highly effective. And if normal circumstances, if it's a normal colonoscopy, you don't need another one for 10 years.
Okay.
So often you'll forget the whole experience by the next time you have to have it. So
Right.
yeah.
So it's really not that bad. It
Yes.
just seems worse
That's
than it
right.
is, right?
That's right.
Okay. So another question on Facebook Live. You mentioned genetic syndromes. How often are syndromes such as, and I'm going to butcher this, I'm going to need your help, Dr.
Sure.
Jani. Is it Peutz-Jeghers? Is that correct?
Yeah, so Peutz-Jeghers.
Peutz-Jeghers.
Right.
Okay, so how often is something like this caught in just a routine screening?
Again, very rarely. Most of the genetic syndromes. Now, something like Peutz-Jeghers, which is sort of what we call a juvenile polyps, things like this mostly will be captured in younger populations. But again, very rarely is it picked up if you looked at all sort of patients that came from screening. Now, that's different than those patients that may have symptoms. You know, so for Peutz-Jeghers, they may have some associated symptoms, and that's what came to the diagnosis.
Okay. Another question. A parent wrote in, I have celiac. My daughter has had issues. When she was a toddler, I asked her pediatrician if I could put her on this gluten-free diet.
Mm-hmm.
Since switching her diet, she has been better. I've never had her tested, though, for celiac. Is this okay? If the diet is working, does she even need to be tested?
So, yes, the answer to that is she should be tested for several reasons. One is that we want to know if it is truly celiac or is it just a gluten sensitivity. The other reason is that there's other associated symptoms with celiac that she may develop over time. And then the third is that we want to see has she had some regression of the inflammation and other findings with celiac by being on a gluten-free diet. So yes, I think it is worth getting tested, and it's also worth knowing if that's truly the diagnosis. There is blood testing that you can do for celiac, but the gold standard remains endoscopic biopsies of the small intestine.
Okay, another question. Can fatty liver affect the heart, and if so, what would the symptoms be?
So I think fatty liver directly may only have impact on the heart if it's caused advanced liver disease. So you can get passive congestion into the heart from the liver. But overall, fatty liver does not have a direct link to cardiac disease, but it may be a marker of someone that has underlying either high blood pressure, high cholesterol, diabetes, which, as we all know, directly will affect the heart.
Okay, why would one have diarrhea and a change in bowel movement even with a normal colonoscopy? Shall I increase water intake, 8 to 10 glasses a day? They're best probiotic.
So I'm interpreting the question as they've developed diarrhea after the colonoscopy?
That's what it sounds like to me, or they've at least had a colonoscopy that was normal, but they
Still have
diarrhea on a regular basis.
So again, I mean, so there's two ways of trying to interpret this question. So the question is, did you get a colonoscopy because you were having diarrhea, and the colonoscopy was normal, so maybe you didn't find a reason for the diarrhea? And that's when we get into the whole spectrum of, sort of irritable bowel with diarrhea, which is a very real disease. If you're asking the question of, well, I developed diarrhea after a colonoscopy, it's probably not really linked. I mean, obviously there's a small chance of an infection with colonoscopy, but again, this is rare, and that should be evaluated. But there's maybe just some alteration in your overall gut flora for some reason, secondary to either the bowel preparation or colonoscopy, and it may take some time to reset. So again, I think preliminary testing should be done of the stool, and seeing your physician further work that up.
You see a lot of people these days going gluten-free, a lot of people with celiac. Is that
Sure.
Just having that diet in general, would you say, is that healthy for somebody who doesn't have
Right.
celiac?
So let me clarify. So it's interesting, gluten has got a lot of press. The incidence of celiac in the general population is still extremely low. But the incidence of gluten hypersensitivity is much greater. So, and we see this has been well documented in children. And again, I think it gets back to the fact that a lot of our wheat is processed.
Mm-hmm.
So I think that, overall people do feel better on low gluten or gluten-free diets. They have less bloating, they have less sort of gastric or gastrointestinal discomfort. So I do recommend that in a lot of my irritable bowel patients.
Okay, another question coming in on Facebook. Why give the child gluten if their symptoms are improved? Any testing has to be done following a gluten diet. Is it really worth it? How much can we depend on genetic testing if our kids have one genetic marker?
Okay, so it's a pretty involved question, right?
Yeah.
So I agree that if your child is doing well on a gluten-free diet, I'm not advocating to come off the gluten-free diet. But I think genetic testing is important. Now, if you have one marker, you may be not full-blown celiac, but you may have at least a little increased risk than the general population.
Okay. Another question about their child. My 10-year-old daughter wakes up with stomach aches every day. It seems like it's reoccurring every time she eats. We've had her tested for celiac and dairy issues. Everything has come back negative. Everything from fruit to greasy food seems to give her a stomach ache, and sometimes even makes her want to vomit. Any idea what this could be? We've tried probiotics. Nothing seems to help. Anything to calm her stomach?
Sure. So again, this should be, if you haven't already been evaluated by a pediatric gastroenterologist, I would definitely advocate that. And then the question is what is the underlying pathology that needs to be evaluated? Some simple things that we do, at least in the adult population, because I particularly don't treat children, is peppermint oil. So we do use a formulation of peppermint oil, which has been very good at sort of soothing the gut. But again, I think a really thorough evaluation has to be performed for your child.
So I've heard runners complain of, I don't know if it's called runner's diarrhea, but those having to go to the bathroom when you run. Is that a common problem for runners? Very
common problem. And there are certain suggestions. What happens is that often a lot of runners or triathletes will have a high carb meal or high carb supplements, whatnot. That may be one of the precipitating factors of this. So they get almost like a dumping syndrome. Second is that your motility, what's happening is that, obviously as you're doing this aerobic exercise, your blood flow is more to your heart and your brain and your muscles and less to your gut. And so the gut can't really process anything at that point, and it, sort of wants to empty. So there are certain tricks to this. One simple trick that you can do is taking something that just slows down your motility, something over the counter like Imodium prior to a run, and also just being careful of what you're using as a supplement.
Okay, good questions. Well, we have gone through most of our questions that we have here. Is there anything, any common question that you get that we didn't hear, that we didn't get on Facebook Live that you would want to share?
Sure. I think this has been a good opportunity to really show you the spectrum of GI diseases, and most people don't know exactly, what a gastroenterologist does. But we do see a fair amount of, acid reflux, which has become a very common medical problem. I think that the message I'd like to send out is that, if you're suffering from these problems for a good number of months, don't ignore it, especially if you have lower gastrointestinal symptoms such as abdominal pain, change in your bowel habits, blood in the stool. You should seek medical treatment.
And if you have any of the symptoms that we've talked about today, can they call you directly, your office? Do you have to be recommended through your family physician?
Often patients can directly call our office here at GBMC, and we're happy to see patients of the wide spectrum of diseases.
All right, Dr. Jani, thank you. And also, we have a story airing tonight at 11 with Dr. Jani, so if you missed this, tune in tonight at 11. It is more on how colon and rectal cancer is on the rise in young people. We'll talk more about that, and more on the colonoscopy, the ages, if you missed that. So tune in tonight on ABC2 at 11, and you can also see it online at abc2news.com. Dr. Jani, thank you so much for being with us.